With us now is Dr. Rachel Klein. How have you been?
I've been well, thank you. How about you?
Good. So we met through a mutual friend named Jenna, and she had told me about your practice and the ways that you're helping the community. And I wanted to shine a light on you to tell you thank you, because during this time, a lot of, especially let's just say people that are over a certain age, they're afraid to leave the house. They can't leave the house, and their dental care is poor, and that's causing them to even be sicker.
Yes.
Because a lot of people don't understand that your mouth is, connected to the rest of us.
Right.
So tell us in your experience why you decided to create this particular part of your practice.
Okay. Well, I've said this before to other people who asked, but when I was in dental school, my grandmother, she was a really beautiful woman. She had a lot of pride in her appearance. The kind of woman would tell you, don't leave the house without lipstick, without getting your hair done, And she was, she was on insulin Kettering. She had some medication that made her dizzy. She wasn't supposed to get up. She got up, she fell, and she broke her 2 front teeth. And it was so devastating. And I went with her to the dental clinic, and they had to extract those fractured teeth. And then they made her an appliance. And I said then, this is really what I want to do. I want to help people like that. And then I worked in nursing homes. I worked in private practice. And then one day I was reading the New York Times, and there was a section in the Metro section about a woman named Elisa Kaufman. And she has a website called Geriatric House called Dentistry. And she does this in Manhattan. And I said, this is my calling.
Yeah,
so
this is who I am, right?
Right.
The core of my being. This is what I want to do.
Right. So I reached out to her and I joined her network. And now she has other people in Pennsylvania, California. Like, she's trying to spread it around the world because, like you said, there is this underserved community that really needs our help. And I'm fulfilling my dream.
A lot of times, too, they don't drive when they get to be a certain age.
Drive.
Right?
They can't
Right.
get out of their beds. Forget bedroom. I'm often in the bedroom on my knees. I do a lot of funky positions, and there are a lot of people that are unfortunately very demented, a lot of Alzheimer's patients, and they can't even speak. So half the time we don't exactly know what the problem is, but they're not eating and people see that something isn't right. Or then you have the patients where mom hasn't been to, COVID and this and that. Mom hasn't been to the dentist in 5 years, 10 years. I once had 30 years.
Oh, my goodness. Yeah.
That was a rough one.
Okay. And do you find that once they have that they're, like a cleaning, that they're like smiling more? Have you seen, like, the next time you go to visit them?
I can't tell you how rewarding this job is. I get texts like, you changed mom's life, her day,
Wow.
and then there's a lot of people that you wouldn't know. This whole thing that happens, people are, let's say, in the house, and then they have to go to the hospital, and they lose their denture. They lose it in the ambulance. They lose it in the hospital. The nursing home throws it away. The assisted living throws it away. So then we have to help them, bring back their dignity and their smile and make them be who they should be, give them that quality of care that they deserve.
I grew up watching a TV show, Marcus Welby, MD. And he used to make house calls because
Right,
I'm a little
right.
older than you, but I love that show.
No, I was saying to someone before that, a house call is something from the 50s, but we're bringing it back.
Bringing it back. What better time than to bring it back? So on a daily basis, do you try to do it geographically? So you're not just going from Montauk to Manhattan, and then,
Right.
do you say, okay, on Wednesdays, I'm in this area of the island, and on.
So that's like a real big part of my thinking, because
Right.
I also go to Queens. So some days it's just all Queens, and some days it's Long Island. And if I'm making a denture, or, I have to go twice in the week. So I'll go in the beginning of the week to, let's say, everyone on Long Island, and then the next day everyone in Queens, and then bring it back another day in the week and just set it up like that. But I live on the South Shore, so I have to go all the way out to the North Shore and then work backwards and, try to make everybody happy. Sometimes you can see the family, and sometimes you don't, but I communicate with the family a lot because they want to be a part of it, and they should be. So if they can't be there, I always, take a picture and I show them what we did and how happy mom is. And
Now, do you have like a portable x-ray machine, or what are some of the tools that you
Yes.
use that you carry with you in your bag?
my bag of tricks. So again, like the night before, I have to think about what I'm doing and pack my bag accordingly. And so I have one whole bag just set up for dentures, and one bag that has my x-rays, exam, cleaning, extraction, and we can also, all of these things we can do, but I just have to be prepared. So I ask people when they call me or email me, provide with as much information as you can. So
Or
I
even
bring
maybe
the
a picture.
Exactly.
Right? Right? Here's
Yes.
my smile. Or
No,
here's my tooth.
it's not a joke.
Right, exactly. And you're able to visualize it and kind of know where you're going into.
When people look at my phone,
Right.
they don't want to see my pictures. It's not all pretty, but that's the
But
way.
the afters are pretty.
Right,
Not
right.
the befores, but the afters are pretty.
Right.
Is there one thing that you would like to offer to other people across the globe about your practice that they, may want to start one in their city?
I like I said, I mean, I would tell people if they want to be a dentist that serves this community, they should look up geriatric house call dentistry and get in touch with the network and see how they can do it in their state or their city or what have you. But what I want to say is I just really, like you said, I really want people to understand how important dental hygiene, dental care is. And when you have a broken tooth, sometimes it's not a big deal, but sometimes it really can be. And it can be sharp. It can cut your lip and your tongue. And people really, it's terrible, the pain that these people have.
I'm so happy that you had such a loving grandmother and that you had such a good relationship with her.
Me too.
You're honoring her every day of your life. So that's a beautiful story. And thank you for spending some time with us. I know when you walked in, you were like, wait, I'm sitting on the sofa next to you. I said, yeah. I said, sometimes we do segments like that. It's a little more intimate. And we hope that you gained value out of this. So please, reach out to Dr. Rachel if you're anywhere in the world and you realize how important your dental care is, make an appointment today, no matter where you are. Just go into your local dentist, or, if you're here in this area, make a call and get healthy. Thanks for watching.
Thank you.